My name is Ronald Anglade. I am a urologist here with Georgia Urology, and we're taping here in one of the operating rooms at our Northside Gwinnett Hospital location, where I do a lot of my work. I specialize in men's health, but I also do a fair bit of work in sexual dysfunction, as well as benign prostatic conditions such as BPH and large prostate. The type of procedures we do here in the operating room can range from anything like aquablation for the large prostate, urolift, which is a more minimally invasive procedure. We also will do kidney stone procedures in this room. We'll do cancer procedures in this room. So this is really our home, our cystoscopy suite. Men's health has always been a topic that I've been very interested in. Once I decided to be a urologist, I wasn't sure exactly what type of urology I wanted to practice. But in my training program at Boston University, I was introduced to one of the attendings who I consider one of the forefathers of men's health, a Dr. Irwin Goldstein. And I found his work to be particularly interesting in men's health and sexual medicine. So through his introduction, I began a career in penile implant surgery as well as treatment of erectile dysfunction. In addition, at that time, I also had the pleasure of working with Dr. Robert Oates at Boston University, and he specialized in male infertility, and so that is also a big part of my practice. In this operating room, I do a lot of BPH procedures, so in addition to men's health and sexual medicine, I will treat the enlarged prostate. I will also treat kidney stones here, and that's some of the work we do here with our lasers and instruments that we have here. Personally, in other rooms here in the operating room, I will treat erectile dysfunction, generally with penile implant and prosthetic surgery. Also, we use prostheses for sexual medicine and incontinence. So there are things known as artificial urinary sphincters that we put in for male incontinence, as well as sling procedures for male incontinence. And lastly, in these operating rooms, with the assistance of surgical microscopes, we can do procedures for the treatment of male infertility, such as vasectomy, reversals, and testicular biopsies. So what do I think of when I go to work? When I go to work, I will say that I think that I'm going to do something that will probably help somebody today. And that's the thing that keeps me going to work. Just like any profession, any occupation, a work sometimes can feel just like a job, and it's just something that you have to do. But what we do and what I feel like, what we do at Georgia Urology and what I feel I do here really helps people. And it gives me a certain amount of satisfaction to know that when I go home at night, that regardless of what I did, I probably helped to make somebody's day a little bit better. I will show my age when I say the last medical TV show I really got into was ER. And that show hasn't been on TV for probably about 15 years, but that was my show back in the day. Currently, really, I don't watch much television, so I don't know what shows there really are. But the ER was my show back in the day. That was much see TV for me on a Thursday night was ER. Reason why I chose to work for Georgia Urology, and I will answer that question with a little perspective. I joined Georgia Urology over 20 years ago when I first came out of training, and it's been the only practice I've ever worked for. And the reason being is that I've never been around a group of physicians who I feel so aligned with. And what I mean by that is that I feel we do a good job. We practice ethical medicine. We practice medicine that helps people, and we try to take care of our patients. So with that being said, I've seen significant growth of this practice, and I believe that growth is due to good management, good physicians, but most importantly, a commitment to taking care of the patients who are here in Georgia and are part of our extended family.